Coronavirus. People are scared. Heck, I'm scared. Today, we're breaking down what you need to know. Joining us from the National Institutes of Health via Skype is the director of the National Institute of Allergy and Infectious Diseases, Dr. Anthony Fauci. Here in studio, we're joined by infectious disease expert, Dr. Ravina Kullar. Dr. Fauci, starting with you, can you tell us what the latest developments are with the coronavirus?
And this is a brand new virus. It's called coronavirus, which is in the same family as the virus that caused SARS. It's a respiratory-born illness. It exploded in China, starting first recognition in the end of December. And right now, by travel-related cases, there are now at least 25 countries that have cases of coronavirus in it now, and there have been some person-to-person transmission. We're at a very interesting point in time with this because we're not sure what direction it's going. It could conceivably evolve into a global pandemic if the countries that have travel-related cases do not have the capability of containing them and preventing them from going from person to person to person. So we're really, although the risk in the United States is really quite low, this could change.
Dr. Fauci, I remember medical school reading about the coronavirus. It's a big family of viruses. It's been out there for a while, but this is a particularly new virulent strain, correct?
That's absolutely correct. If you look at the coronaviruses, 4 coronaviruses account for about 10 to 30% of the common colds that we get every year. So when we used to think of coronaviruses, we would think of a relatively mild virus that causes the common cold. Then in 2002, when we had SARS, we found out that this could be a very serious virus that could lead to bad pulmonary disease and death.
Can we just talk briefly about why certain people are dying from this?
The overwhelming majority of people who get into serious trouble are people who are either elderly and or have underlying conditions like heart disease, chronic lung disease, diabetes, obesity, and things like that. But every once in a while, just like we see that with influenza, you get an otherwise perfectly normal, healthy, young person who gets the infection and actually gets seriously ill and or dies from it. The median age of this disease is about 56, and the median age of people who get into trouble requiring intensive care and sometimes intubation is somewhere between 65 and 75. So it really is a disease that, for the most part, if you're going to get a complication, it's either in the elderly or in people who have underlying conditions.
So, Dr. Ravina, I want to ask you, because you just came back from a conference with the World Health Organization. So what is the latest from the worldwide perspective?
Looking at the way the Chinese government actually hid what was happening, looking at how they downplay the severity of the disease, I think that's where this all started. We could have prevented this from even happening if the Chinese government was a little bit more forthright with us, and if they just also even let the World Health Organization and the CDC help. At that point, it was already too late. 5 million people at that point already traveled for the new year, and that is what caused this transmission.
You raised such a good
point.
point.
The cat was out of the bag.
The cat was out of the bag.
These people had already left China to literally go all over the world. And
exactly.
That's why we're dealing with such a different situation here. The travel now is so easy. People don't think twice about flying around the world, halfway around the world, whatever. That means every part of the world at risk for transmission.
This is the thing with infectious diseases. They don't care about having a passport. They don't care about borders, and they don't care about walls. And this is where we are at now. And from a global scale, what's happened is that any travel to China has been banned, and any coming here. And so that can at least contain it.